Imagine your kid's school canceling classes, not because of a strike or a storm, but because there aren't enough teachers. Wait, what? That's not a sci-fi future. It's quietly happening now, and it could change everything from the health of your family to the strength of the economy. Most people think teachers and doctors are the safest jobs you can pick. Steady pay, respect, and work that society literally depends on. Your brain already bookmarks these careers as secure. But behind the scenes, the numbers tell a different story. Schools and hospitals in rich countries are simply running out of people. UNESCO says we need millions more teachers by 2030. The World Health Organization warns of an 11 million health worker shortfall by 2030. Those are global, concrete gaps, not vague predictions about robots stealing jobs. This is about people who aren't being trained fast enough to replace retirees. Here's the simple mechanics. Populations are aging and birth rates have fallen. In places like Japan and Italy, over 1 in 5 people are over 65. That means both more demand for care and fewer young people coming into the workforce. Training a teacher or a doctor takes years, sometimes a decade. So shortages today reflect policy choices from 10 or 20 years ago. Even though teachers and doctors often earn above the national average, doctors in the US average about $230,000 a year. The path is long, expensive, and stressful. Student debt, heavy workloads, mountains of admin, and housing costs make private sector jobs look much more attractive to high-performing graduates. When shortages bite, governments pull a fast lever. Import trained professionals. Visas get fast-tracked. Tens of thousands of health workers arrive in a single year. That kept hospitals and schools open in the short term. But migration doesn't create new doctors or teachers. It moves them. Imported professionals often treat the destination as a stepping stone. Once they gain experience, some move again to higher-paying countries. The UK, for example, now has roughly 1/3 of its doctors trained abroad, and about 1/4 of nurses who are non-UK nationals. That helps today. But it doesn't build stable, long-term capacity. Shortages change how systems behave. Class sizes creep up. Teachers become less experienced on average and are asked to cover more subjects. In healthcare, waiting lists grow, diagnoses are delayed, and outcomes worsen. In England, long waits are linked to roughly 250 preventable deaths a week. Those are human costs that ripple into lower productivity and higher inequality. Lower quality schooling today means weaker skills for the workforce decades from now. The World Bank shows learning quality matters more for long-run growth than just years in school. Fewer doctors and nurses means more preventable illness and earlier exits from the labor force. Over time, growth slows and inequality widens. The people who can buy private alternatives get better service. Everyone else waits. And there's another layer. When rich countries recruit from poorer ones, they can drain the systems that need those professionals most. Ghana and Kenya lost large shares of doctors to migration, which is a massive loss after investing in training them in the first place. Some places show it's fixable, but only with long views. Portugal spent decades expanding medical school capacity and now has one of the highest doctor-per-person ratios in Europe. Romania cut doctor emigration by improving pay and conditions. Those are slow, expensive choices, but they build resilience. AI and other tech aren't a magic replacement, but used right, they're force multipliers, cut admin work, speed routine tasks, and free doctors and teachers to focus on the human parts of their jobs. That can make careers less exhausting and more attractive. If the tech is implemented to support people, not to de-skill them. So what should you care about? When schools and hospitals are understaffed, your family's health and your kids' learning are affected. And that shows up in the economy you live in. Policy choices today, investing in training, improving pay and working conditions, using tech smartly, determine whether shortages stay temporary or become the new normal. Wait. So the real risk isn't robots taking jobs. It's a slow acceptance of understaffing in the most essential professions. That slow drift changes society in ways that are hard to undo. If we treat teachers and doctors like temporary problems rather than national infrastructure, the costs arrive quietly. And then suddenly, next time you hear headlines about AI taking jobs, remember this other story. Some jobs are vanishing not because of automation, but because we didn't make their pipeline sustainable. Think about who we plan to keep our schools and hospitals staffed, and what that choice means for the future. If you enjoyed this video, please give it a thumbs up and subscribe for more.